A very good day to one and all. I am Dr. Rohit Gopinath, and today we'll be discussing about abdominal tuberculosis. Now, tuberculosis can be said to be an ubiquitous condition. It affects all parts of the human body, and among the different parts of the human body which can get affected by tuberculosis is the abdomen. Abdominal tuberculosis is in fact the sixth most common type of extrapulmonary tuberculosis. Abdominal tuberculosis is generally said to be a disease of the immunosuppressed. It is very common among individuals who have been inflicted with HIV, and it is also common among individuals who have malignancies, other malignancies, any malignancy in fact, who are on immunomodulation or immunosuppression. But it is to be noted that just because it is more common among the immunosuppressed, it does not mean that it cannot occur in the immunocompetent. Even individuals with a good healthy immune system can get affected by abdominal tuberculosis because there are other mechanisms based on which they can get affected. Abdominal tuberculosis can be subdivided based on the area of the abdomen that is infected. So you can have intestinal abdominal tuberculosis, in which the ileocecal junction is most commonly involved. This is further subdivided as ulcerative type, hyperplastic type, and ulcerohyperplastic type. Among these three, ulcerative type forms 60% of cases of intestinal tuberculosis. We can also have peritoneal involvement, in which case it can be again subdivided as acute and chronic. Chronic peritoneal tuberculosis is again divided into ascitic type, encysted type, or encysted type is also called loculated type, plastic type, and purulent type. So, plastic type is the classical cocoon abdomen that we get. You can have tuberculosis of the mesentery, you can have tuberculosis of the anorectosigmoidal region, miliary tuberculosis involving the solid organs, you can have tuberculosis of the omentum. Now, there are different modes by which this tuberculosis comes to lie in the abdominal cavity. So, the modes of spread of tuberculosis can be either by ingestion, and this ingestion can be either direct ingestion of a food substance which is contaminated by the mycobacterium, or it can be because of ingestion of sputum, of the patient's own sputum, which is contaminated with tubercle bacilli. So, most common method by which you can ingest some contaminated food particle containing mycobacterium is by ingesting contaminated milk. So, the most common mycobacterium subtype which can be present in contaminated milk is Mycobacterium bovi. So, ingestion of milk which is contaminated, it can be one of the methods by which you can develop abdominal tuberculosis. And the sputum, if a patient has a primary pulmonary tuberculosis foci and he is bringing out a lot of sputum, he can sometimes swallow that sputum, and this swallowed sputum can again result in abdominal tuberculosis. Now, tuberculosis of the abdomen can also occur by hematogenous spread. When you have tuberculosis involving the lungs, you can have miliary tuberculosis, which is nothing but disseminated tuberculosis, where every other part of the body can get affected, including the abdomen. From the neck nodes via the lymphatics also you can have abdominal tuberculosis occurring. Now, there is an entity called a retrograde tuberculosis, wherein you can have retrograde infection of the abdomen peritoneal cavity through the fallopian tubes. So, that has also been documented, and you can have direct spread. Let's first discuss about ileocecal tuberculosis, which is a type of intestinal tuberculosis. It is the most common site of abdominal tuberculosis, that is, the ileocecal junction is the most common site of abdominal tuberculosis, and the most common organism causing abdominal tuberculosis, particularly intestinal tuberculosis, is Mycobacterium tuberculosis. So, it is an acid-fast bacilli. We will be discussing more on that as we come to the investigation part. Like I said earlier, Mycobacterium bovi is also known to cause ileocecal tuberculosis. You can have ileocecal tuberculosis occurring either by direct, wherein you ingest food materials contaminated by the mycobacteria, or by hematogenous route, which is as a part of a miliary tuberculosis. Mycobacterium avium is also known to cause ileocecal tuberculosis by a lymphatic spread. So, like I had mentioned earlier, among the different types of ileocecal tuberculosis, ulcerative type is the most common. It forms 60% of cases of ileocecal tuberculosis, and the name itself is self-explanatory. So, it is characterized by the presence of circumferential transverse ulcers, as you can see here. This is a diagrammatic representation, and this here is a gross specimen showing this type of ulceration. These ulcers are typically multiple in nature and they are called girdle ulcers, and they are characterized by presence of normal mucosa in between. So you have multiple ulcers with normal mucosa in between. So hence they are called skip lesions. Once this ulcer occurs, any ulcer tends to heal with fibrosis, or any wound as a matter of fact heals by fibrosis. So this here causes a fibroblastic reaction and there is dense fibrosis occurring, resulting in stricture formation, and these strictures are classically called napkin ring strictures. And ulcerative type is characterized by nodal involvement and there will be extensive bowel adhesions, particularly if these ulcers become transmural. Hyperplastic type. So hyperplastic type, like I mentioned earlier, even in the ulcerative type, there will be a certain degree of fibrosis going on. In hyperplastic type, this fibrotic reaction is taken to another level. So there is increased fibroblastic reaction resulting in thickening of bowel wall. So this is actually palpable from the outside as a mass in the right iliac fossa, which is nodular in nature. Now, generally, hyperplastic variant of ileocecal tuberculosis occurs in well-nourished, immunocompetent individuals, and it is less virulent. And the classical area of the intestine involved, among the ileum and cecum, it is cecum which is more commonly involved by the hyperplastic variant. Caseation in this case is very uncommon, and generally the mode by which you get hyperplastic type of ileocecal tuberculosis is primary, by ingestion of food particles which are contaminated by the Mycobacterium. Now, clinical features of ileocecal tuberculosis. So, typically the patient presents with an abdominal pain which is non-specific, or sometimes it might be localized to the right lower abdomen. Commonly it is seen in individuals between 25 to 50 years of age, and usually when the person presents to the clinician, they tend to have anemia, loss of weight and loss of appetite, which are basically constitutional symptoms of tuberculosis. Diarrhea is known to occur in 10 to 20% cases, along with fever, which is low-grade fever, in 50 to 70% cases. Now, like I said, the hyperplastic type of ileocecal tuberculosis can present as a mass in the right iliac fossa, which is hard, nodular, and nodular, which does not move, which is immobile or fixed, with no skin involvement. So, when you have such a mass in the right iliac fossa, it is one of the most important differential diagnoses for a carcinoma cecum or for an actinomycosis involving the ileocecal junction. So, the differential diagnosis for a right iliac fossa mass, common three differential diagnoses with relation to the bowel would be ileocecal tuberculosis, cecal carcinoma, adenocarcinoma, and the actinomycosis involving the ileocecal junction. So, these three should be kept in mind when we want to discuss regarding any bowel pathology presenting as a mass in the right iliac fossa. Of course, you can have other causes for a right iliac fossa mass, but with regard to a bowel, these are the three important differential diagnoses for a mass in the right iliac fossa. It can be associated with an adenocarcinoma of the cecum, which is very important in fact. So, just because a person has an ileocecal tuberculosis and there is a mass, it may not always be right to attribute that mass in all cases to an ileocecal tuberculosis. It can be an association with an adenocarcinoma of the cecum. And also, of course, like I said earlier, other immunosuppressed states can be associated with an ileocecal tuberculosis like a HIV. When you have a large mass which is in the RIF with dense adhesions, it can cause a small bowel obstruction. So, intestinal obstruction is also a mode by which a person presents to a clinician.